news this afternoon. The Erie County Sheriff's Office says they've made major improvements at both the Erie County Holding Center downtown and the Erie County Correctional Facility in Alden. Both facilities are now accredited in health services by the National Commission on Correctional Health Care.
This accomplishment comes as the Sheriff's Office was under years of scrutiny after a number of inmates died in the county's care. Right now, we are joined by Erie County Sheriff John Garcia. Sheriff, thank you so much for coming in.
Thank you for having me. Appreciate it.
So first, set this up for us. For those who don't know, what does it mean to be accredited?
So when I took office, I promised the people that we were going to bring in a 21st century law enforcement agency. With that being said, we received state accreditation for our entire agency last year. Then we received state accreditation for both facilities, the one out in Alden and the Holding Center, our civil unit. We didn't stop there. This is all voluntarily. And what we're trying to achieve is best practices, policies, and procedures to be implemented. So what we did is we went, and it was a heavy lift, but we received a national accreditation for correctional health care.
And Sheriff, talk about the process, because people may see accreditation, and it's often, most often in terms of the media, presented from law enforcement and things like that. But what accreditation means is a lengthy, months-long, sometimes several months-long process where people come in and they literally open your files and look through every piece of paperwork. It is a very, very close scrutiny.
Well, that's exactly what happened, Dave. This is 2 years in the making. And, you know, our correctional health care now in correctional facilities is so robust. I mean, we do absolutely everything from mental health, physical health. We do, substance abuse and so forth. So our costs this year for pharmaceuticals will be far greater than our food costs. That goes to show you how much we do. So experts come in, national experts, and we have to be in compliance with nearly 60 standards, 400 substandards. And like you said, Dave, they go through each and every item to make sure that the delivery system is safe, that people are being assessed properly. And we're one of few jails that have this national accreditation. And we're not stopping there. We're going to get national accreditation for the correctional facility itself. When we obtain that, which I know the people that are doing this want to do it, you know, they want to do it. Our staff wants to do it. We'll be one of 4 jails in New York State. And that includes all the state prisons and the county jails.
Wow.
So that's it. And you got to remember, when they built this jail in 1938, they were worried about people escaping. You know, they had 6 escapes in 1937. They said, we're building a jail no one's going to escape from. Well, it's 2024. We're delivering the best food, therapy, counseling, peer programs, programming, job development, and healthcare, which is huge.
And national accreditation, it's no easy feat, like you said, and it's a pretty big deal. What are the benefits that come with that?
Well, I'll tell you, the people there feel empowered, because when you're in a profession like this, you want to deliver the best services. And, you know, I tell people to always remember this. We are the people's law enforcement agency. And when you go around the country and you say you're from Buffalo and Erie County, you're proud. So I want people to be proud of their Erie County Sheriff's Office. And this is about taking somebody who's sometimes at their lowest point in life, and they come in, and you know, the availability of health care out in the community sometimes is non-existent for a lot of people. So when they come in, it could be diagnosing something, you know, I don't want to say as simple as diabetes, however, it's curable, right? And, you know, the substance abuse, we do methadone, Suboxone, Vivitrol for alcohol withdrawal. And all of this makes the person stabilize. And once we have the person stabilized, because when they come off the street, they're hot, you know, I mean, they're coming in with charges, physical ailments, then we could build on that and do programming. And, you know, they got their case to worry about. Am I going to lose your house and whatever? And it also creates an atmosphere of less violence, right, towards each other, the incarcerated, and with our staff.
Sheriff, the things you're saying right now, really, the last couple of answers you've given is a far cry from what these jails certainly were used to, and thus the Erie County Sheriff's Office. You said just before, you want people to have pride in their Sheriff's Office. Well, for years, in the early 2000s, the Justice Department had to oversee the operations of the county jails because people were dying, whether by suicide or maltreatment or abuse. How hard has it been to change that tide? Because I know that was one of your top priorities when you entered office. And you still have a ways to go, despite
Absolutely.
these accreditations, right?
Listen, it's been 2.5 years. It's been a big lift. We have antiquated facilities, but we have the greatest asset we have are people. And, you know, allowing people to really bring out the ideas, because they're the ones doing it day to day, has made this office really move forward positively. The DOJ is no longer in oversight.
Yep.
The New York State Attorney General's office is visiting on Tuesday. So they're visiting both facilities. They made a recommendation. Their internal auditor, which was embedded in the sheriff's office, has made a recommendation to lift the AG's oversight.
That's a big deal. Say that again. I mean, that's been years. That's been in place for several years, right?
Yeah, the New York State Attorney General's office, as you know, their auditor has made recommendations to lift the oversight. That is a huge win. And listen, I don't have an issue with oversight. The issue is, you know, that we have oversight because we're not doing things right. We still have the State Commission of Corrections. That's the oversight for every jail. And listen, you're not going to get more oversight than me as a sheriff and our staff, because I always say, do things the right way, always, especially when people are not looking.
Yeah.
Well, unfortunately, our time is short. Erie County Sheriff John Garcia, thank you so much for taking the time this afternoon.
Thank you, Jordan. Dave, thank you.
Appreciate it.
Appreciate it.